Good morning, good afternoon, good evening, wherever in the world you might be. I'm Safwan Masri. I'm Executive Vice President for Global Centers and Global Development at Columbia University. And it's my great pleasure to welcome my distinguished panel for this very important discussion and to welcome our audience joining us from all over the world, and in particular, our students. One of the great privileges of my work on behalf of the Global Centers is the opportunity to take part in discussions like this one that address our most pressing issues with experts who are leaders in their fields. I always come away feeling more informed and, just as important, hopeful. Two qualities that I really value, especially now in 2020, as we all do. Today, I'm looking forward to a discussion that is, I would say, less timely than it is omnipresent, reflecting a topic, COVID-19, that many of us return to frequently with our own friends and family as we try to make sense of where we are in this pandemic's timeline. To address the relevant issues and their attendant questions, my dear colleague, Dr. Emmanuel Captain, Director of the Alliance Program, along with Columbia Global Centers, Paris, the Mailman School of Public Health, and École des Hautes Études en Santé Publique, have brought together 6 panelists to share their perspectives on the spread of and response to COVID-19 in Europe and the United States. It's clear, based on the daily headlines we have all been reading for the past year, that COVID-19 is not just a medical issue. It is also a social, political, cultural, and economic issue. Every institution and every human being has been impacted. To help lead us through the many complex issues with our esteemed panelists, I'm pleased to introduce my colleague and friend, Professor Julie Kornfeld, who will be our discussion moderator today. Professor Kornfeld is Vice Provost for Academic Programs and Associate Professor of Epidemiology at the Mailman School of Public Health. In addition to her work as Vice Provost, Julie is a scholar in public health education, and she teaches in the core curriculum at the Mailman School of Public Health. Professor Kornfeld and I have been working together this year as part of Columbia's initiative to support international students who, due to the pandemic, are unable to return to the university campus. For us, and indeed for all of our panelists, today's discussion isn't just academic or theoretical, it's professional, it's personal, and it's close. Julie, over to you.
Thank you so much, Safwan. I'm really excited to begin this panel, and I think you will join me in welcoming this very distinguished panel. I think we have a slide to show with our panels, so you can see who's joining us today. We have panelists here from France, as well as Italy, and from Columbia University in New York. Thrilled to have a student who join us to give us a student perspective. So thrilled, please join me in welcoming this distinguished panel. I think as we look across the globe, as Safwan indicated, we are in the midst of a pandemic that has raised several critical issues that I think require a tremendous amount of examination and dialogue, and we could probably be here all day and night talking about some of these issues, but we will try and take a deep dive into several of these issues and open up the conversation. We have the opportunity for you to ask questions. I think you can put the questions in the chat, in the Q&A, if you will, please, and submit those questions, and we will turn to those at the end. So we hope to start the panelists with a discussion, with some conversation with our panelists, and then we will turn to your questions after that. So I'm going to kick this off, and we hope for this to be a conversation and allow for some dialogue back and forth. But I'll start by saying that I think this pandemic is certainly a reminder to us that global health solutions in the face of a crisis require countries and governments to work together. Yet I think the reality is that we have seen very little coordination between and among nations, and in some cases an appalling lack of leadership in bringing these countries together. So I'd like to ask each of you, if you'd like to comment on how you have seen that play out from your unique perspective. You could talk perhaps about how the EU has or hasn't played a role in this. I know the WHO also has a coordinating role. So I'm gonna, maybe Daniel, if you wouldn't mind, I'll turn to you first for a comment, and then please invite your colleagues to join.
Thank you very much for this this invitation. Well, maybe just to begin the conversation, just by saying that it is probably not that obvious to compare the situation across the Atlantic and comparing Europe and the United States, given the very different strategies and given the very different epidemiological situation in both regions. But I would like just to underline first the fact that probably we are facing a situation in which there is both a lack of leadership in both areas and as well a search for leadership. And this is the case quite obviously as far as we can see it from Europe in the United States with the main decisions made by President Trump during this pandemic. But this is also the case when you see the situation in Europe at community level, at European level, with the lack of leadership from the beginning of the pandemic, and with quite different strategies and put in place in different countries, at least from the beginning. And now from the autumn, what we see is a search for something new, with an endeavor to define something more collective and with a stronger leadership with the election, the presidential election in the United States probably, and in Europe with a better coordination between member states, not only on the economic level but also on different initiatives taken on very health issues. This is specifically the case on vaccines, but not only. This is also the case for the analysis of some epidemiological elements in the European CDC as well. So there are these kinds of beginning of a leadership in both areas, and probably this has to be noticed. This is not that easy, because when you see it, and we do it like that very much in Europe, considering the situation at the level of the different member states of the European Union, the leadership is as well something problematic in different countries, with very strong debates about the role of central government versus something more decentralized organization. And this is the case in many European countries. In France, we have something which is very centralized in our institutions, but we have this debate with different balances according to countries. This is the case in Germany, but this is also the case in Italy, in Spain, in Switzerland. There are very strong debates about this way of coordinating national policy, even when considered at national level, at the level of member states of the European Union. So there are certainly very difficult questions to consider at this on this question of leadership, of political and scientific leadership, to define strategies against the pandemics. Just to begin.
Alexandra, maybe from Italy, would you maybe want to comment from your perspective?
Yes, thank you very much. Indeed, I mean, on a more general level, I do believe that, especially in the so-called first wave, this COVID pandemic has highlighted once again that how much the actions of one country can have profound implications for other countries, and that the disease doesn't know any borders, of course. In the first wave, starting from March, in April, what we have witnessed, and I think everybody agrees on that international response to COVID-19 pandemic was rather fragmented, uncoordinated, and there were problems basically on all levels within the countries, as mentioned by a colleague before, but also across countries. Even just comparing, like the scale of the problem was problematic and complicated by adopting different definitions in different countries, data collecting, reporting. If you think about, even now, we still have disputes about how to calculate the excess mortality due to COVID across countries. So we have this comparison across the data that even though the WHO has tried to bring in some methodological agreement and provide guidelines on how this excess mortality should be calculated, we still have discrepancies and differences across countries. So it's even harder to compare the scale of the problem when you have such uncoordinated efforts between the countries, even in measurement. But of course, the measurement was not only the problem. Think about also the testing and the fact that different countries use different types of tests and so on. So there is a plethora of actions that have been fragmented, uncoordinated, maybe inevitably, given that we were all somehow caught by surprise. Italy, for sure, being the first country in Europe that had to face this unprecedented challenge. These problems existed also within the European Union, where there are mechanisms that could make the better coordination and somehow the coordinated response across countries. And it was even more evident, in a broader European region, like WHO defines WHO Europe, because there are other countries outside also the European Union, because again, I think these differences was really highlighted and exacerbated by differences in the public health structure. The second wave gave us, unfortunately or fortunately, to a certain aspect, the second chance to make things better, and in terms of coordination. And in European, at least within the European Union domain, there are some efforts to make now. Also, we are talking about, approach to vaccination and so on, to make things more coordinating. I remember the Minister of Health in Italy in the first wave somehow being a little bit disappointed about the lack of the European level coordination in the response, because Italy at the beginning was somehow left. That was the feeling that, there was not a great coordination at the central level in terms of the procurement of individual protection devices, in terms of testing and so on. Again, the pandemic is lasting long enough, unfortunately, to improve also in that aspect, but in that issue. But I do agree that the lack of coordination did somehow maybe had a negative effect on the way the pandemic was managed, at least within the European Union. And I do hope that this is a lesson to be learned for the future of international governance for health issues.
Greg, can I ask you maybe to comment? I know certainly your perspective on the front line in the first wave, and from a US perspective, how that lack of coordination affected you as a physician or as well as a public health leader.
Sure. So yeah, as you mentioned, I was in New York City. I had heeded all the warnings from what we were hearing from Italy, all of the images, and speaking to people there who were trying to give us tips for how to prepare. And really just weeks later in March and in April, we were just absolutely inundated and overwhelmed in hospitals in New York City and in the Northwest. But really, kind of my experience with this goes back even further, where in 2014, I was working in West Africa. I'm taking care of Ebola patients. Since then, I've been incredibly interested in how we prepare for events like these, because in 2014, many were worried that Ebola was going to be this pandemic. And we knew it's just like the mechanism of transmission, the contagiousness of it. That's not what was going to be the big concern. It was going to be something like a respiratory illness that spread by asymptomatic carriers. That was going to be the big cause. And we knew it was coming eventually. And a lot of us were comforted by the fact that the US had ranked very highly on the Global Health Security Index. We were number one. We were the most prepared. We did a lot of tabletop exercises, including just over a year ago, for an unknown disease, something like a coronavirus, that would do exactly what this one has done to our hospital system and to our economy. The one thing that we didn't factor in all that preparation was an administration that, quite frankly, was working against us as opposed to with us. And I'm hearing Alexandra talk about her experience in the EU, and Daniel as well, kind of the frustration of not having common definitions or not being able to work together. That is understandable in a sense when you're talking across countries. But here, what we've experienced that it's happening within the same country and sometime within the same state. You may have one state bordering another that has different public health policies based on their partisan leanings. And that has made it very difficult for us to have, one, a national response that's well coordinated, that gets us the things we need, you know, PPE, providers, medications, et cetera, in a very, you know, efficient and thoughtful and timely way. That hasn't happened. And even worse than that is we have had really this ongoing assault against science and very basic public health, which I'm sure everyone listening has heard on behalf of this administration. It's frustrating as someone that took care of patients in March and in April, that just yesterday here in the US, we set new records for hospitalizations. Over 100,000 people are hospitalized. We set a record for new cases, and we set a record for the number of COVID deaths in one day. And this is, again, 8 or 9 months after, you know, people in Italy sounded the alarm. Even in New York City, since then, I've been going on radio and TV and writing just to try to raise the alarm so that people understand we need to take the right public health measures to get this under control. And that has been actively kind of reversed and undermined by an administration that should be, again, working with us and has unfortunately been working against us. At the same time, you know, Daniel had mentioned, we're at a point where we have a new administration coming in and we're all quite hopeful, but we've gone from poor leadership to a complete lack of leadership. Right now, in this transition, we don't have the outgoing administration really doing all that much. It's been quite silent on COVID other than with the vaccine. And we have a new administration that's coming in that has been committed to focusing on science and on public health, but won't be seated for another 6 weeks and can't frankly do all that much until then. At the worst stage of this pandemic, we are left without any type of leadership, and we're reliant on kind of state-led initiatives that frankly have been led largely by partisan leanings. And that is, I think, why we're starting to see and continuing to see a surge upon a surge in an already horrible pandemic here in the US.
Thank you. Pascal. Pascal, did you want to comment?
Yeah, thank you. I think the situation in the European Union is quite different from what we see in the US clearly, and I'd like to nuance a little bit what my colleague said about the lack of leadership, because in my opinion, as an epidemiologist, is that the best response in terms of epidemic control is the response that is adapted to the situation. And the virus did not hit all Europe at the same time, at the same place. And and Italy, for example, was as you said, Alexandra, was the first country to be hit and pretty hardly hit. And hit pretty hard by the virus, and you served in a way as a kind of a warning system, you know, a wake-up call for the rest of Europe, and so the measures that were taken in Italy, I mean, had to be taken in Italy at that particular moment, and it's certainly sad that maybe the rest of Europe did not take the same measure, but it was not really possible. I mean, the virus was not circulating at that level. It started to circulate then more heavily in the east of France, but the east of France was hit mainly because we had a huge cluster of cases, like several hundreds of people infected in just a few days, which made the circulation of the virus very important in that part of France, and that served as a kind of second wake-up call for the French authorities, and so the response had to be adapted to that as well. So this is, I mean, also why I think it's difficult to have a kind of European response. I mean, regarding specific control measures. But having said that, there's also another thing that makes things difficult, is that in order to have a good coordination and a good response plan, and a coordinated response plan, you need to have a plan. And you need to know what to do in those situations. And to be honest, I don't know that we really knew what to do in this kind of situation, because we never had this kind of situation. I mean, such a pandemic, this kind of pandemic start. Let's say we've seen it in Southeast Asia with SARS in 2003, and then there was the alert also regarding the avian influenza in 2005. Then maybe the flu pandemic, which was a little bit different in 2009, but not at the same scale. So, and the measures that had to be taken are totally different, because the situation was very different. So we were kind of all trying to find the right response, and we all, I mean, in terms of countries, we kind of all did it by trying new things and assessing whether they were good or not.
Alex, Alexandra, would you like to comment? And then I'll take us to another question.
Yes,
Please.
just a brief response. I do fully agree with Pasquale. I just want to clarify that I was not arguing that the coordinating measures, preventive measures should have taken place in the European Union, because I do agree that it had to be context specific. What Italy somehow at the beginning was left, I wouldn't say left alone from the higher level coordination, that some of the issues I think were, like, for example, centralized procurement of the masks, or the centralized definition of what tests should have been done in the European Union. So what are the valid tests, what are not the valid tests, those some common rules for European citizens that were somehow delayed because of this idea that it was at the beginning Italian problem, and then then we realized it was not only, of course, Italian problem. So in that sense, of course, that the measures, the lockdown, the very strict lockdown that we all experienced in the spring 2020 was not conceivable in other countries not facing the same threat. But I think there were some missed opportunities there, especially in the first wave, that we could have done better.
Thank you. Complicated. So I'm going to switch gears a bit. And I think, Craig, you mentioned this already. And much of the plans and the planning of a crisis relies upon a trust in science and evidence-based practices. And I think since the onset of this pandemic, and really at every critical turning point of this pandemic, we have seen an alarming lack of trust in the scientific process and actual real challenges to legitimacy of science and research. And maybe I'd like for each of you to maybe comment on how this has hindered, from your perspective within your country or across countries, how this has hindered policy and population responses that could be more effective, and also how it's hindered individual actions. Because I think we all know that this pandemic has required both. It has required collective action at a policy and a population level, but it has also required individual action. And yet this challenge to science has posed problems to both. And I'm not sure who wants to jump in first. Perhaps Daniel, may I turn back to you, since we've seemed to have gone around? You're on mute, Daniel.
Sorry for the mic. Yeah, just a word maybe to underline what we know now is that probably it is also an unprecedented situation on the role of science, which is clearly on the forefront of all those debates. And this is clearly something new, at least when you consider it from decades. Probably we could find out some degree of comparison during the world wars, but except in this case of in this kind of situation, there are probably not so many precedent situation to compare it. it's a very difficult articulation to find the good articulation between defining public policy and pouring some scientific results or scientific analysis in the process of decision making. Well, in France, I'm a member of the scientific team of the scientific task force advising President Macron, and we can measure how difficult it is to do the job and to find our way, to find our place in this complex situation. And probably, and maybe it's an impossible place, to be honest, to be in that specific role. But if I had to underline two different dimensions to take into account, I think that to preserve a degree of independence is clearly a key factor, and to preserve a degree of transparency, which is not the case in any kind of task force that implemented in such situation exist, is clearly a second key element. And when we compare different countries in Europe and in a wider context, in different countries, you can observe that the creation of new task forces and new cells dedicated to advise decision makers. And there are very various models in terms of composition, in terms of even of size, in terms of roles. Some of them are more administrative and linked with public health institutions already in place. Some others are more academic in nature. So you have different balances and different schemas defined in each country, so it's quite difficult to compare, and probably there is no one best way. And my message will be to underline how difficult it is to find the good balance in these dimensions first. And second, maybe what we can observe also in different countries is how the challenge is hard when you consider existing public health institutions. In many countries, the challenge has been very strong, both in the public debates and sometimes in the connection with decision makers in the United States. In England, for instance, Public Health England has been dismantled during the first wave. In France, we have very strong debates about the role of these institutions, and so there is clearly a challenge of the existing situation, and in the meantime, the creation of new task forces that have to find their way, which is all but clear and all but simple, trying to put on the forefront some scientific elements in a context of uncertainty for the scientists involved, for the decision maker who are their counterpart, and obviously for the public. And this is the context in which we have to find our way. And clearly, in different countries, we have different solutions and different balances. And probably this is one of the reasons why it was not possible to have a coordination from the first day. We had first to have our national experiences with this kind of new situation, and then trying to find a degree of convergence between those very distinct experiences in similar or quite similar context in different countries.
Thank you. I think it's, I think for those of us involved in the scientific process, we are used to dealing with uncertainty, but translating that uncertainty in the midst of a crisis and through intermediaries, through the media, I think is also particularly challenging. I mean, maybe Craig or you could comment on that, because I know you've been very involved in sort of the translation of science into the media, and we're used to saying, well, we know more now than we knew then, but that leads to a distrust or sometimes a disbelief in that we know what we're doing. Right.
I've tried to be involved in translating science really to the general public, but a lot of what I've been doing is trying to really represent science and protect it against kind of mistranslation and misinformation. I think the quintessential topic here is mask use in the United States, which for many Europeans is probably pure craziness, that it is one of the most political decisions that you can wear. You know, the likelihood that, you know, Democrats will wear a mask is significantly higher than it is for Republicans all over the country. And that's because very early on, this became a political rallying cry, whether or not you believed in mask use. And early on, the evidence wasn't great. And early on, it was recommended that people don't wear them if they don't need to, if they didn't need to go outside, because we didn't have enough masks here in the country to protect our own healthcare workers. This has now become cemented really into this religious truth for a lot of people, including people in my own family who won't listen to me, who think that, you know, the data just isn't there and the scientific process clearly isn't good if early on they weren't able to tell us that masks were really important. You know, the one thing I think that's so important here is that our job as public health professionals, as healthcare providers, is really to help get the right information to the right people. Throughout this, we've seen, especially here in the United States, we've seen those really long trusted public health authorities like the Centers for Disease Control and Prevention, like the FDA. They've been muzzled in many respects. We're now starting to see the CDC come out a bit more. You know, the CDC's role is to be first, be right, be credible. And when you don't have the CDC out in front, who's going to be first, who's going to be right, and who's going to be credible? It's the people that are willing to take that space. And the people that have been willing to take that space have been on social media. And the result has been a lot of misinformation and disinformation that has gone viral, that has resulted in a lot of people finding trusted sources that are completely misinformed and leading them down the wrong path. Unfortunately, I wish I could go on the news and I could do what I'm doing and really just represent true fact. But the majority of time, what I'm doing is trying to, you know, defend science against a lot of misinformation and disinformation that continues to go viral. And that is ultimately, I think, the biggest threat to public health here in the US and our ability to get this pandemic under control.
Other panelists, I mean, Soraya, maybe as a student, have you experienced this this distortion of truth, this lack of trust in science, and how does that play out for you?
I think it's interesting that the discrepancy between the experiences of healthcare workers and people who are making public health policy and decisions, and the general public, including students or instructors who are not in the medical field or scientific field. And when you see what the response Columbia had as a university of shutting down early before the national shutdown in the state of New York or in France, it seems that information and decisions happened to us as students and instructors, and we had to adapt, and juggling multiple contexts in the case of students who flew back home, like me, for instance. I flew back to France. And it's interesting from what you said to see that even in the case where there is leadership, this leadership is having to grapple with the crisis as it unfolds. And on the receiving end, this this means a lot of uncertainty and having to constantly adapt. And yeah, so there's this constant back and forth, I think, between the global context or national context and more local and individual decision making as well, because as an individual, we're having to suddenly make daily decisions, or even in our gestures. And so you can point to a lack of leadership in many cases, but even in the case where there is appropriate leadership, it's a very unsettling situation, I think.
Thank you. Yeah, I think we in times of uncertainty, I think we see many things step into the vacuum and makes it difficult to make decisions, perhaps collectively as well as individually. I'm going to build a little bit on the election year politics that we've certainly seen in this country, a collision, if you will, of public health and politics. But I think it's also, and I think this cuts across borders, although it's played out differently in the United States, as Craig has talked about. I think it also has played out in Europe too. And what we've seen is an exposure of deep political division, a polarization of ideas, in many ways that have shaped, I think, both the individual and the collective responses. And perhaps we heard Craig spoke a little bit about this on the US side, and maybe we could speak a little bit more about this on the European side. And, you know, how has that amplified the impact of the pandemic, this polarization of ideas, this divisiveness? I don't know, Alexandra or Pascal. Alexandra, please.
Yeah, I can briefly comment. I mean, it's not, I mean, it's of course related to this concept, also Italian experience, that however shows more discrepancies between different levels of government. As Danielle mentioned at the beginning, in a very decentralized healthcare systems like Italian one, we have witnessed from day one this need for coordination and stronger leadership or stewardship at the central level with the regions that had like somehow opposing, and also which was linked to the, let's say, political parties in charge of a specific region. So this tension between the central level and the regional level was present from day one. At the beginning, in the first wave, when the national government imposed a national lockdown, so treated everybody the same way, regions were complaining that they needed more local measures because they were not hit by the virus in the same way. In the second wave, we were all hit by, because the virus spread around the country, the central government started to impose some differentiated measures. So dividing the country in three colors: a red zone, orange zone, yellow zone, and then imposing measures according to the color of the region. Of course, there were complaints and critiques that the red regions were the ones who were in opposing political party than the central government. So they were somehow, even though they were they ended up in that category according to an objective algorithm on the basis of data. But again, there was this political tension between those who ended up in that red zone, and they were forced to do more a stricter control measures. So now they were arguing for unity. They were arguing for the same treatment across the regions, because so differentiating across regions was not good enough. So now we are back actually tonight, 20 minutes after we finish our call, 8:20, we have the speech by the Prime Minister, who will tell us how we're going to spend our Christmas and the New Year's. And now I think we are back to the unifying measures across all the regions, because all Italians should be treated equally. You know, how many people they can meet for Christmas, whether they can go visit somebody. So again, we are back to the more national level. But it was this back and forth between the different levels, also colored by political parties who were in charge of different regions, that really complicated a lot the situation in Italy, and also made people doubt the trust to the central government measures and the regional government. If the government within itself questions, so the regions question the authority of the central, they don't trust the central level, then the citizens themselves in the regions, start not to trust whether those measures have been taken on the evidence, so evidence-based policies, or there is something else in the play, which again, it's really dangerous when you deal with such an important challenge for the country.
Someone, did you want to ask
Well, I'll wait, but Pascal wanted to say something, so I'll...
yeah, please.
No, it's Stephanie.
No, go ahead, Pascal, please.
Pascal.
No, I just wanted to add that it's, we need to keep in mind that it's relatively easy, and it's kind of recommended for scientists to be able to say, I don't know, or I'm not sure, or we're not sure. But for a politician, that's a lot more difficult. A politician that says, or someone in a place of power would say, I don't know, I'm not sure. I mean, that's terrible. And when you have a government which decide to follow science, at one point there's an interplay between what we know in science and what the politician need to make as a decision maker. And so, and it goes by, I mean, it goes back to then to journalists and other politicians to take this and to then judge both the science and the politics with the same grid, in a way, with the same kind of rules. And so we, at one point during the crisis, and I'm pretty sure that Danielle will have a better example and better comments on that. At one point, I mean, the scientific debate became kind of public and was kind of judged as if it was a political debate. And we even at one point saw polls trying to answer scientific questions, like if it was easy to find the right answer. I mean, you just ask the population whether hydroxychloroquine works or not, and well, 55% of the population says it works. Okay, so maybe it works. So that's not how it should work in science, and that's not how science should be judged, for sure. But there's, I mean, but we saw that during this crisis, and I think it should question us about how we talk about science and how we educate the population to receive scientific messages.
Can I have a brief comment on this? I really want to underline this message because I think scientists, at least in the Italian case, I mean, they did a wonderful job, but also added to a mess because, you know, in the communication domain, because really we had for months TV shows, virologists, specialists, everybody had their own truth, and people, that scientists are holders of the truth, which is, you know, not actually the case. And, you know, science needs time to find the truth. We need methods. We need, you know, to test things. We need to learn the knowledge as we know how it's generated. And having different messages from the scientific community. We had clinicians, you know, on the TV, very famous clinicians speaking about virus is dead, they are exaggerating, this is all campaign, so people got relaxed. Other people saying, other clinicians, other scientists saying, no, this is not true, it will be worse than ever. So in that mess, you know, the public, the general public really, you know, lost an orientation, but also lost trust to what the scientific community has to say. And they are not educated. They don't know that there is uncertainty in, you know, before we get to some scientific findings. So whether the masks work, whether the specific active principle works, whether the vaccine will work, you know, as we all hope at the, you know, at the mass level. But again, I think that, you know, I'm not arguing that all the, you know, scientific curricula should include a course on communication, but those informing general public should have some some training about it.
Julie, I just wanted to interject. I mean, and I find that the issue of the politicization or the tribalism, if you will, associated with which data and what information one believes or does not believe, the whole issue of political leadership also, back to what Craig was saying earlier. I mean, question, there is a certain level of trust, I think, that has emanated over the past few months of local governments relative to national or regional sort of leadership, and we've also seen, and you know, correct me if I'm not representing this correctly, but I'm in Jordan right now, and in countries like in Jordan, you see a huge divide between the urban and the rural. You know, in rural and more conservative areas, you know, masks are a foreign entity, and there is a sort of a disbelief that there is even something called corona. And the last dimension to this, which I've been fascinated by, is the role of women in leadership positions. And you look at Europe, you look at Germany and Angela Merkel, you look at New Zealand. There are other examples around the world where women leaders have been able to sort of control things and bring things into, I don't know, just sort of, greater credibility and greater containment. Am I correct in those in those conclusions, if you will, and sort of, what do you see in terms of our collective learning coming out of this about these issues? And to anyone.
Maybe one word again. Those are very good points. There is certainly a gender issue, both on the political side and even on the scientific side. I don't know if it's so easy to draw conclusions from now. What I would just say about the divides between rural and urban, and so many other divides. We were beginning with the divide between centralization and decentralization. What strikes me most on these pandemics is how you have always this kind of tensions between opposite options, which are on the table, and it's so difficult to articulate them properly. And what is sure is that you cannot choose one side against the other. It's always a kind of very subtle balance to find between both. And this is how you can manage a situation, and practically speaking. And on the other side, you have public debates, you have media debates, you have political options. We tend to polarize them very strongly as the good option to take, as to define it clearly as an option which considered as the most relevant one. And obviously, when you go this way, you have immediately the opposite options and a fight against both options. In France, typically, we had these debates, and it was very politicized from this viewpoint. Clearly, Safwan, and I agree with you on the politicization of those questions. And you had, and probably it still is present in France with questions about public health, about the management of the epidemics, which will be transformed very easily in pro or anti-Macron political decisions, like it is in the USA between pro-Republicans versus against Trump and all that. And so that this strikes me very, very much, how the situation is always a very subtle articulation between different options on the one side, and the trend to polarize very much this option in the public debate. It was at least the case from the beginning. I have the impression that from the second wave, the public debates are less polarized than they were at the beginning, and probably there is a kind of lessons drawn by the general public and general population and leaders and considering this kind of uneasy positions to define. There is no easy, whatever the solution, it's not easy. It's just something subtle to define.
Yeah, thank you. I don't know if anyone else wants to comment. One of the questions I'm looking at the questions from the audience, and one of, I think it speaks to this a bit, which is, we see varying rates per 100,000 in different countries, and the question then becomes, I think, among people, why are things more severe in one country versus another? Is it really due to leadership? Is it really due to policy? Is there something else at play? And maybe that's a question from one of our audiences that one of our audience members, of just, we see different rates from the US to Britain and France, and what can we attribute to that? And I think to some of the questions or points that you all have raised, what do we learn from where things have worked well? I would vote for the female leader, but that as one as an factor associate. as a factor associated with good health outcomes, but you know, maybe from Craig, I don't know, or others, if you want to also talk about, you know, what's really the difference? Can we just point to lack of leadership or divisiveness, or are there other things that are leading to differences among and between countries?
Sure, I'm happy to chat on that a bit. Look, I don't know about causation and correlation for female leadership and being able to get a virus under control. But if you look at kind of the counter of that, look at where things have been the worst, right? It's been in the United States, where we had a president who, you know, daily downplayed the severity of this. If you look to Brazil, which has had a surge and continues to have a huge number of deaths, you have the exact same, right? It's the exact same rhetoric, the exact same language, and the exact same approach. In other places in the UK, in Russia, places where you've had kind of more autocratic, or you've had, you know, leaders who have not taken this seriously, who have downplayed the public health, we have seen the worst outbreaks. I think the other thing that we don't talk about a lot, you know, and understandably, because we're all on the panel, you know, from Western Europe or, you know, from the US, is, you know, we haven't seen as big an outbreak in many places that we were concerned about really early on. In March and April, I was concerned that this was going to be worse in Mozambique than it was in Missouri. And my guess is that we haven't seen the full scale of how bad it has been in many developing countries and many places where we don't have the same level of testing, we don't have the same level of insight in reporting. But thankfully, to this point, we don't think that it's been as bad in those places. So is there some other underlying population dynamic like obesity, chronic health conditions, older age, et cetera? That's likely at play, but there's probably other things that I think will be further elucidated as this pandemic goes on and as we kind of look back at this retrospectively.
Yeah, great points. Pascal, did you want to make a comment?
Yeah, I just would like to add that it's at some moment it's relatively complex to make comparison because the surveillance systems are very different from country to country, and so, for example, I mean, I have a colleague in Mexico who tells me that COVID-19 tests in Mexico are done in hospital on paper. I mean, they are asking questions to the patients. And based on their symptoms, they say, okay, it's COVID-19 or not. So RT-PCR testing, for example, is not something that is done everywhere. So it's difficult to compare Mexico, Brazil to the US or to France, for example. And it's also very difficult to be sure that even in rich countries like, I mean, European countries or even in the US, to be sure that we are really counting every cases. And we know that, for example, in the US, but Craig, maybe you have more details on that, but there's an excess mortality that kind of shows that, well, all deaths are not counted, and it's a little bit also like influenza. You know, people die from COVID-19 or die from something else, and maybe COVID-19 was the thing that made them past, and so, well, so we need to be very careful with comparison, and then to comment just on Africa and the good news in a way in this dramatic situation, showing that the burden of the pandemic was not as heavy as we had expected in Africa. Well, I think it's maybe a little bit of lack of surveillance, maybe, but I also think that it's also because of the demographics of Africa. I mean, when you have in France and in Europe 20 to 25% of the population who is older than 60, and at the same time in West Africa, for example, only maybe 5% of the population who is of that age, in the end, you do not end up with the same morbidity and mortality with such a disease. We also know that the spreading of the disease is also very impacted by how people live, whether they live inside during the winter, for example, or not. And so the pattern of contacts between individuals is also something that is has a huge impact on the dynamic of the epidemic. So I'm sure we will have years of science to try to explain, all the dynamic and all the differences. But we will find reasons among those.
Thank you. Great points of we'll certainly have reason to keep epidemiologists employed for quite some time in terms of being able to track and understand the impact of this. But I think, many of the questions from the audience were really about how do we make comparisons among and between countries. And I think you all have offered some really good insight as to, what are the limitations of being able to do that, and what are the challenges in doing so. I know we're getting close to the end of our time here, and I wanted to do a quick round robin if I could, to ask each of our panelists maybe to comment on what you're this is a time in the pandemic where I think we're all feeling a tremendous amount of anxiety as what the next few months will bring. And yet trying to balance that with some optimism for what is coming with a vaccine and its eventual distribution and where we might be 6, 9, or a year from now. So if I could, I'd ask each of you to maybe just tell us what are you most optimistic about? What are you most worried about as we are right here, right now in December 2020? So I'm going to go around my screen if I could and just ask each of you. Pascal, you want to start us off?
Oh, thank you, because I'll start with the easy one. Vaccine, for the reason to be optimistic, and the reason to be pessimistic would be vaccine hesitancy, for sure. And I think, we started the panel with this issue of coordination, and I think that Daniel said it earlier. I think the coordination that has been put in place in Europe regarding vaccination and vaccination procurement will hopefully, set a precedent for Europe, and there's I think reason to be very optimistic regarding that.
Craig, you want to go next?
Sure. When I was working in an emergency room in March and in April, and it was inundated, getting sick patients who couldn't breathe, every few minutes. We didn't know when this would end. We didn't know when our surge would end there. We didn't know how long New York City would be able to prevent from having another surge. What we know now is that there is an end. There is light at the end of the tunnel. It is going to be a very difficult next few months for us here. And I have some concerns that people are seeing the end game without understanding that we've got to play beforehand, and it's going to be quite dangerous. But we know that in 6 months, the majority of the people in the United States will likely be vaccinated, and that in a year, we will return to some sort of normalcy that many of us have been longing for quite some time. So I hope that it makes it a little bit easier for people to kind of continue to follow those public health recommendations that we've been saying for so long, but which now that people have an end goal and have some light at the end of the tunnel, may be more likely to continue to support.
Alexandra?
Yes, not to repeat my colleagues, I would like to adopt a little bit more longer term view of what I'm hopeful for and what I'm concerned about. Well, I'm hopeful that this pandemic has convinced at all, from general public to the high level policymakers, how important, if not to say essential, is the functioning of healthcare systems for the societies as a whole. So that investments in health and healthcare are not the costs on the finance sheet of the government, but are investments that are served for the rest of the society. So I'm really hoping that this is we paid a high price to learn this lesson, and I'm really hoping it's going to last a long time. What I'm mainly concerned with is the social inequalities that this pandemic has created, and I think we're going to witness them for a long time. Income inequalities between protected and unprotected, education inequalities. I think we're going to have some long-term consequences in the societies across the globe that we will have to, make up for, but not necessarily it will always be possible with the government intervention or wanted with the government intervention. So I think that in that sense, given the centrality of health in also other domains of functioning of the countries, we will have these long-term consequences for a while. Thank you.
Thank you. Great point. Great points. Danielle? You're on mute, Daniel. Sorry.
Sorry. Thank you. No, I fully support all what has been said. I would just add that this is not only about healthcare. Probably we experience the lack of public health at local level, especially, and there are probably some investment to do on this field. And Craig insisted on this point earlier, and I think this is a very important one. I would also say that there is a sort of a reevaluation of the role of the state as well, which is also something important to underline from that viewpoint as an investor, as what we call well, I won't say it in English, so sorry for that, but so it's so important to have the special role of the state from this viewpoint. But I think that we are still in sort of another hesitancy between something more evidence-based, science-based, bureaucratic on a way, and even sometimes authoritarian in a style on the one side, and something more democratic, something more inclusive, more direct relation in a more direct relationship with the population. And clearly, this is these are two different options, and what we see from one country to the other, from one regime to the other, from even the different moments in the same country, those different options are not that clear for the moment, and probably there is something which is quite important considered from a wider political and democratic viewpoint to consider in the coming months.
Thank you. Soraya, do you want to add thoughts?
Yes, similarly to Alexandra, my concern would be with the consequences in terms of suffering and loss, whether economic or, as someone in the Q&A said, mental health. And in terms of hope, I think the pandemic may have allowed for a revaluing of the importance of community, whether understood as a global community or a very local community of peers.
Thank you. Yeah, thank you for those thoughts. We had a comment and Soraya mentioned about comments on mental health, and I too worry about that the long-term consequences of the mental health, both of our frontline providers and the communities that were tremendously affected by this. As we turn to our vaccine, I think we also have to turn to support for those that were affected by this virus, whose impacts will be felt for a long time. As an epidemiologist, I'm optimistic that public health careers are going to be very trendy for coming time, and we need a workforce of public health professionals and to help us educate the public, to help us educate the journalists and all the policymakers that are so critical to this discussion. So, thank you. I'm going to turn it over to Safwan to close us out here, but I want to thank you personally for your input and tremendous engagement. What a wonderful conversation.
Thank you.
Bye-bye.
This was incredibly instructive and hopeful. And if you ask me what I'm most optimistic about beyond the vaccine and once we get out of this crisis, is that as humanity, we will have learned very, very important lessons at the individual and collective level, and we will emerge from this hopefully working better for our futures. I want to thank each and every one of you, Pascal, Danielle, Craig, Alexandra, Soraya. It's always wonderful to have the students partake in the discussions, and Julie, your expertise and your moderation skills, I think, have benefited all of us. And as I said in my introduction, I always walk away from these things, really feeling that I've learned a lot, and I have learned a tremendous amount from each and every one of you. And I'm sure that that is the case for our audience. I want to thank Emmanuel Captain from the Alliance program for putting this together. And I want to thank also my colleagues in Paris, Joelle, Sinead, Michelle, for all the work that they've done behind the scenes. So thank you, thank you,
Thank you.
Bye.
Thank you all.
Thank you all.
Thank you.